CT of the abdomen and pelvis. Now in this video we're going to be looking at some of the anatomy within the abdomen and pelvis, specifically the liver. We're going to be identifying the gallbladder, the right and left adrenal glands, kidneys, ureters, and finally we're going to end the video by identifying the urinary bladder. Now, before we get started, let's have a look at this image in front of us. So here we have a CT image, an axial image. So in other words, a cross section or a cut, in this particular case, through the upper abdomen. Now, the top of the image is known as the anterior aspect. So this is the front of the patient, if you like. And the bottom of the image is the back of the patient, or the posterior aspect. So this patient is laying down on their back, what we call the supine position. Now, if we look at the left-hand side of the image, this is actually the patient's right side. Yep, so they're facing us. So our left is the patient's right, and our right, or the right of the image, is actually the patient's left side. So we're looking at this almost back to front, okay? This applies to CT and many other imaging modalities as well. Now we're going to start at the very top of the abdomen, the upper quadrant, and then we're going to move down all the way inferiorly to the pelvis. So let's get started then. Now the first structure that we can see here is the liver. So this organ is huge, as we can see in front of us. So right at the very top of the abdomen within the upper quadrants, in this particular case on this slide we can see it's mostly on the right side, the right upper quadrant, but what we can see here is very large. It's very large. In fact, it's the second largest organ of the body. So let's scroll down. So we're moving inferiorly now, we're scrolling down, we're moving down the patient, and we come across this structure here. This is called the portal vein. So this area that looks a little bit more white to the surrounding liver is known as the portal vein. Now this is an important structure because this carries blood from the abdominal organs to the liver. Let's carry on. So here we can see the left adrenal gland. Now, the adrenal glands can be quite tricky to identify because they're very, very small, in relation to something such as the liver. So they're very small structures. They are towards the posterior aspect of the patient, so towards the bottom of the image, as we can see. Now, a top tip for you is that these adrenal glands, they tend to appear like a V shape or an upside down V. So if I scroll through over here, we can see, if we look really closely, it almost looks like an upside down V. That way we know here we have the adrenal gland. Now we can just about see the left kidney coming through now. So it looks very small because we're right at the very top of that kidney. We've taken a slice through the very top part of that kidney. So it looks very small at this moment, but we're going to scroll through and we'll see that more clearly in just a moment. We can now see the right adrenal gland come through. And again, we've got that V-like shape. We can see the gallbladder. Now we can see those kidneys more clearly. We can see the right and the left kidney. Now we can just about see the right and left ureter. So we have a right ureter, we have a left ureter. These are the tubes that connect the kidneys all the way down to the urinary bladder. Now, these are really, really small structures in terms of their thickness, right? Very small. They appear like two very small dots here on the image. They're very long, of course. If we wanted to look at the ureters more clearly, same with the kidneys and the bladder, we would usually take a very specific type of CT scan called a urogram, a CT urogram. Now, we haven't taken the CT urogram in this particular case, so the ureters are very difficult to see. These would appear more white if we were to have taken a CT urogram. But we can follow these all the way down, and we get to the point here where we see the bladder, the urinary bladder, because we also have the gallbladder. And here we go. We can see the urinary bladder come through now. So in the pelvis, we're in the pelvic area. We can see the bony pelvis surrounding that. The bladder appears quite distended. It's full. Yeah, we've got lots of fluid there. And there we are. Okay, so I hope you found this useful for your studies. Do check out my other videos. We're going to be looking at some of the other anatomical structures within the abdomen and pelvis. Thank you for your time. Like and follow for more.